The simulation center that we have today is a dream that started about 4 years ago. And the reason that we wanted the simulation center is to supplement and augment both the didactic and clinical experience of our undergraduate and graduate students. In today's world, we have learners who must be active learners. And the Simulation Center allows our students to not only take the theory that they learn in the classroom, but apply it in the Simulation Center. The result is that we have very clinically competent, compassionate clinicians who have excellent outcomes.
This is 2-week-old Audra. You want to check her armband?
Yeah.
In the simulation, we had a 2-week-old infant named Audra. She was brought into the emergency department by her mother because she hasn't been eating well. She was really fussy, and she had an upper respiratory infection the week prior.
She's grunting with her respirations.
She's tachycardic. Her heart rate's 182.
I'm going to check her mucous membranes. They seem dry.
She's also tachypnic. Her respirations are 84.
Her diaper's also still dry.
We did an assessment on her, found that her fontanelles were sunken, her membranes in her mouth were dry, she hadn't been urinating in her diaper, she had a very fast heart rate and fast respiratory rate.
Her coloring doesn't look that great. I think I'll get an OT sat.
Okay.
89. 89. Wow, that's low. I think I better call the doctor while you start some oxygen.
All right. So we called the doctor to get an order for the oxygen as well as find out what other things he wanted us to do for her. We got her O2 saturation up to 95% with the oxygen. We also started an IV bolus on her at 35 milliliters an hour just to kind of rehydrate her and get her back up to her normal level. And she also, she returned to a normal color. She was no longer dusky. And she stopped kind of grunting, and she was breathing better, and her respiratory rate and heart rate also returned to baseline.
Our patient is Noelle. She's a 33-year-old female who just delivered her first baby 4 hours ago. She had high blood pressure during labor, and we started her on magnesium sulfate, and now the nurses are coming back to check on her. Hey Noelle, how are you feeling this afternoon?
I don't feel good at all.
You don't feel good. And she said she was feeling dizzy, and so we laid the head of the bed down. We assessed her fundus and her bleeding and saw that she was hemorrhaging. So we massaged her fundus, called the doctor because her blood pressure was dropping, and we put oxygen on. I'm going to massage your fundus, okay?
I'm going to stick some oxygen on you, okay? Just take deep breaths for me.
We received orders from the doctor, and we gave Hemabate to stop the bleeding.
All right, Hemabate's in.
We continued to massage her fundus until it firmed up and the bleeding had slowed down.
Mr. Kearns is a 59-year-old male. He had just returned from the cath lab. He had an occlusion in his coronary artery, so they placed a stent, and he had just returned back from his procedure.
Hi, Mr. Kearns. Welcome back. Hey, how you feeling?
I'm just going to listen to your heart, okay?
We started our regular assessment on him, got vitals. We did a neuro assessment, we assessed his pulses, made sure everything, all his extremities were perfusing. As we were going through that, we were checking his rhythm, making sure everything was okay with him, and then he started to have chest pain.
Okay. Chest is starting to hurt. Can you rate the pain on a scale of 0 to 10, 10 being the worst you've ever felt? About a 5, okay.
We ended up giving him 2 milligrams of morphine, IV push.
We're going to give you something for that pain, okay? And let us know how your chest feels after we give it.
Yes, right now you are.
We gave him morphine. We assessed his pain to see if it had gotten any better, any worse. He complained that it was getting worse, and it eventually progressed to a 10 out of 10, so we called the doctor.
I called the doctor and notified him that I had Mr. Kearns. I notified him of all the background information that he needed to know in order to see what the doctor thought would be the best intervention for this patient at the time. So he ordered me to give 4 more milligrams of morphine IV push. And at that time, the patient's rhythm status started changing, and he actually went into ventricular fibrillation. So at that point in time, I told the doctor, hung up, got the crash cart, the priority intervention started kicking in, the airway, breathing, and circulation, and we had to issue a code immediately.
I'm going to go ahead and charge it on 200.
Talk to me. Everybody clear?
Clear.
Shocking.
We had a 2-person CPR going with the chest compressions and the respirations, ratio of 30 to 2.
All clear?
Clear.
All right, shock.
Charged to 200. We shocked him the first time, then we assessed his rhythm and started back CPR. He was still in VFib. Charged again to 300. Did the same thing, assessed the rhythm, still in VFib, so we went to 360. Assessed the rhythm, and we shocked him back into sinus rhythm.
Clear. All right, good. Good. Oh, good. Back in sinus.
Okay.
Mr. Kearns, can you
back
speak to
with
us?
us?
Mr. Kearns, can you hear me? Let's check for a pulse. Normal sinus.
Pulse is present.
He's back at normal sinus.
Hey, Mr. Smith. My name is Emily. I'm a graduate student nurse anesthetist. I'm going to be here today getting you a little sleepy for this procedure, okay?
From the very beginning, what we did was we came in, we hooked up the monitors, we put the mask on the patient, let the patient breathe oxygen, and we talked to them, introduced ourselves, told them who we were, and let them breathe oxygen. And after a few minutes of doing that, we gave them drugs through the IV, got them off to sleep. Once that was done, we do the intubation. So we were putting the tube through the cords. That's the tube that would breathe for the patient with the ventilator during the surgery.
Okay, you're good?
Mm-hmm. Okay.
All right, I'll take your blade.
All right, thank you. Okay. And hooked up here. Got some tooth fog.
Good deal. Let me
Chest
listen for
rise.
breath sounds here.
Internal CO2 is present.
Okay, sounds good over here.
Okay.
Okay, sounds good there too. We'll just get some gas turned on there and secure the tube, and I think we'll be ready to go. All right, so we have gas on, got our flows down, the monitor looks good, he looks good. I think we're ready to prep and drape.
Okay,
Good job.
to me.
I love the simulation lab. It definitely gives us a chance to practice in an environment where our instructors can watch us and give us feedback on how we're doing.
We have had overwhelming positive evaluation from our students.
They are saying that they're learning more from the few hours that they get in simulation than from a day or two in the hospital, which is the objective that we want to have.
I think it's great as far as other scenarios that are not necessarily very frequent in the OR, but they're things that you definitely need to know how to do when those situations come up.
It can be anything from a basic physical assessment on the patients up to something as acute or serious as a cardiac arrest. And they, based on what they do to the patient, what medications they give, what interventions they do, will determine the outcome of the scenario.
It's a great learning tool because it allows students to feel like they can critically think and analyze and try to intervene on a situation. And if there is a mistake that is made, they can learn from those mistakes without knowing that they really have harmed a patient in real life.
You have a chance to be with your classmates so you can make, you see their mistakes or they may see your mistakes, so I think you can learn on the mistakes.
Throughout the mistakes that are made here in the sim lab, you're able to learn more adequately how to take care of a patient in a real life situation. So we learn from those mistakes and expand upon it, and we become more mature as nurses.
You are the nurse, you're taking care of the patient, you're doing any and everything rests on you. You get to call the doctor, you get to call, you get to do all the orders and everything. So simulation it makes me confident going into the nursing world.